Play therapy is a dynamic interpersonal relationship between a child or person of any age and a therapist trained in play therapy procedures who provides selected play materials and facilitates in the development of a safe relationship for the child to fully express and explore self. This includes feelings, thoughts, experiences, and behaviors through play, the child's natural medium of communication. Play therapy can be seen as a process of reenactment or acting things out without words. Non-directive versus directive. Non-directive play therapy is when the child is allowed to direct the play. In this case, the role of the therapist is usually to listen and observe and encourage what the child is doing. Directive play therapy is usually led more by the therapist. They have specific activities that the child can engage in. This kind of therapy usually has a identified topic and goal. There are many different types of play, including assessment play, expressive arts therapy, and bibliotherapy. For the purpose of this project, we will be focusing on sand play therapy.
Sand tray therapy was originally developed by Margaret Lowenfeld in the 1920s. Lowenfeld was frustrated by the traditional talk therapy within psychoanalytical tradition. Lowenfeld felt that it was an ineffective way of trying to understand the ideas, feelings, and emotions of the child. Lowenfeld claimed that her idea of using sand trays in therapy was inspired by the book Floor Games, written in 1911 by H.G. Wells. In the book, Wells describes the various fun-filled games he and his sons played on the floor and encouraged play as a means of personal development for both children and parents. Lowenfeld's sand tray play therapy was called the World Technique. Today, a sand play therapy is used to engage the child's nonverbal communication to understand the ideas and feelings and emotions of the child's inner life. She believed that this approach would serve as a means of communication between a scene builder and the observer, giving the observer insight into the builder's inner world. Lowenfeld practiced this approach with children at the Institute for Child Psychology. Dr. Margaret Lowenfeld was a pediatrician who became a pioneer of child psychology and psychotherapy. Her interest in how children grow and develop and think began when, recently qualified as a doctor, she was involved in relief work in her ancestral Poland after the First World War and wondered what enabled some children to survive and flourish despite their traumatic experience. Lowenfeld's World Technique uses trays filled with sand and collections of miniature toys representing all aspects of their daily lives to enable children to portray their inner worlds. In the late 1920s, Dr. Lowenfeld established one of the first child guidance clinics in Britain in Notting Hill, London. This she developed into the Institute for Child Psychology, which trained child psychotherapists in their theories and techniques while continuing to be the local child guidance center.
So sand tray therapy helps them communicate what they want to communicate in ways that not only allow them to share their experiences, but also learn more about themselves.
As identified by Homier and Sweetney, there are many reasons why sand tray therapy should be used. One of the first reasons is that it allows a service participant to bring to light emotions, feelings, and experiences that they may never have shared with anyone else. Sand-tray therapy allows an outlet for service participants to share their thoughts in a non-threatening environment, which is really important, with the use of various miniatures that are there. As Homier and Sweetney have said, if play is the language, then the miniatures are the words. Another reason why sand-tray therapy is so important is because it's inclusive, in the sense that it allows every member of the family to participate. Even with different ages among family members, each individual has the ability to fully display their unique personalities, likes, dislikes, without interruption. This type of therapy allows each member of the family to have a voice. Another reason for why it's so important is that it offers a sense of structure that can lend itself to creating a safe environment. Sand-tray therapy is made up of different steps that a therapist must be aware of, as well as techniques that are used in order to learn more about what the service participant has created. As Sweetney has stated, a relationship without boundaries is not a relationship. Rather, it is an unstructured attempt at connection that cannot be made because the people have no specific rules for engagement. A world without limits is not a safe world. And children do not grow where they do not feel safe. I think that quote is so important because it points to the fact that therapists and other professionals need to be aware of what they're doing and why they're doing it. So even in sand-tray therapy, there are techniques for how to engage with a service participant, for how to allow them to express themselves and not have to worry that the therapist's own views and opinions will overshadow what their own feelings and thoughts are. And finally, sand-tray therapy allows those who may not have the best verbal skills to share what they might not have been able to tell anyone else. This therapy can be a haven I'm stumbling a little bit, but it's a method in which the service participant can have the control and be in the driver's seat, so to speak. For someone who hasn't had the opportunity to have that control, this is something that allows them to, I'm trying to think of a way to phrase it, but this is something that allows them to feel like they have power. And for kiddos and teenagers, sometimes that's hard because there are a lot of adults in their life, whether it be at school or other places that may be telling them what to do. So sand-tray therapy allows them to direct the process. They can create anything that they want.
I'm Randolph, and we're about to do a scenario with our sand-tray where I just came home from Iraq, and I'm struggling with PTSD, and it's been very hard for me reincorporating myself with my family. I'm suffering from a lot of emotional and violent views from over there, from what I experienced, and we're going to demonstrate this through the sand-tray. She's my therapist. It's going to help me.
My name is Rachel. Okay, the first step in this process, before the session even begins, is to make sure that the room is ready. Now, that means that there's water on hand. Now, I do not have a spray bottle, but we would need water to make sure that the sand, they could actually build stuff in it, get it a little bit wet if you have to,
And we also want to make sure that the miniatures are set out. And so in step 1, it's just preparing the room. Like in any other, say if you were in counseling or any other different environment as a therapist, you would make sure that everything was ready, that the service participants had easy access to them. So say if you have these miniatures, I know this is on the table right here, but making sure that it's in an area of the room where there's a direct line to the sand tray. Now this is not really the typical size of a sand tray. We had to modify it. But just making sure that everything is in place. Hello, it's good to see you again, Randy.
Hey, how you doing?
Good.
Hey, what do we got here?
Well, it's funny you should ask. If you would take a seat, I can explain what these are.
What I would love for you to do with these miniatures is, like I said, pick any amount that you would like. But what I want you to do is build a scene in the sand. Just think of it as your world. So if you are watching a movie and you press the pause button, what would you pause the movie on? What scene would it be? So think of that in terms of your life. What scene do you want to show? So just pick any. Take as much time as you need to choose the ones that are most meaningful to you.
This is what I see at night. This is
Okay.
actually this plays in my head. This is what I visualize. Are these my wife, my son, house, flag. That's it.
Okay, well, why don't we move over to this side of the room? And if you want to put the ones that you've chosen over this way. So here's a chair. So I'm just going to sit here on the other side of the table, and you can tell me whenever you're done creating your world. Take as much time as you need.
Just I'm done.
Okay. I am not a therapist at the moment. I'm just going to describe what the stages that we've been through are, just kind of give an update. We did this stage of preparing the room. as a therapist, I introduced Randy to the miniatures and allowed him time to pick the ones that he wanted. We chose to do a non-directive sand tray therapy presentation, just allowing him to create any type of scene that he wanted. If it was more directive, then I could have said, could you show me a scene of your family? Or something that had more of a topic to it. Since Randy is an adult, this type of therapy looks a little different than it would for a child. For a child, they may not have the attention span to create, as therapists like to use this word, a world. And so the way that I would do therapy with a child would be very different than the way that this technique is used with Randy. Now, that being said, there are a lot of things that could probably be added to this. This is just kind of a bare minimum sketch of what the different stages would be like. And these are the stages that are identified by Homier and Sweeney, the same people who came up with the rationale for sand tray therapy that I mentioned earlier. And so we are going to move on to the therapeutic piece of this. Since he's already created his world, I'm going to process with him as to what some of this means, or just essentially hear what his thoughts are. Because the most important thing is to not convey your own personal meanings onto the world that he has created. The important thing is to just ask open-ended questions and see what these figurines and what this entire picture means to him. Well, I see that you have finished your world, and I would love to hear a little bit more about it. If you could give this world a title, what would it be?
It'd be my nightmare. You know, I keep thinking about my time with my brothers, and what we went through. You know, I think about death. I think about out there serving for my country, and I just wake up and just in sweats, because this is all I see, this is all I know, and it's a strain on my family, because I can't connect to them, and I don't feel they don't understand what I've been through over here, you know, and I keep living this dream of mine, and I feel like I have no purpose. That's why this goblin is sitting over top of my coffin, because I feel I have no purpose. So.
Okay. I noticed that you have a grouping of soldiers over here. Can you tell me a little bit about that?
We was ambushed, and we was under heavy attack, and one of my brothers got shot and killed right in front of me, and I keep seeing that, wishing I could have did more to save him. I felt like it's my fault that happened to him, because I was the sergeant of my platoon.
So, you mentioned that your family's over here.
Yes.
Can you tell me a little bit more about this area?
They just don't understand. You know, I came home, and it's more like it's a distance between us. Trying to be expressive so they can understand what I'm going through. it's been a strain on my family with what I'm dealing with, you know. So it's that distance between us. You know, I'm on the outside looking in. You know, I can't connect with my family, my wife and my son. You know, because I feel like I'm always on guard. You know, it's just been real hard.
Is there, when you look at your world, the one that you created, is there anything that you would like to move around, or as you look at it, is there anything you would like to change?
I would like to change the distance between me and my family. You know, I would like to have that more of a bond. You know, have that more of that connection with them. I've been gone for so long. You know, and I've seen so much.
Well, you've told me a lot about your world. You gave me a good tour. Is there any person or miniature that could help you with some of the things that you mentioned, or any miniature that's not in your world already that you want to add?
Sometimes I want to fly away. So it's because it gets overwhelming. You know, sometimes I just want to fly away.
So
So
tell me a little bit more about what flying away means to you.
to escape this reality, this nightmare, you know, I want to fly away, you know, because, like I said, I feel like I have no place, nobody, you know.
Yeah, you mentioned that earlier. Thank you so much for sharing your world with me. We are going to talk about this in our next session. And I want you to think about what are some of the things you mentioned in this world. So some of the things that you told me. Think about how are they present in my life? And you mentioned a lot of things, and I want to talk about those more. But for now, we're going to end. But thank you so much for coming in, and we will do this again.
Thank you.
You're welcome. So I will see you again next week. Thank you for coming.
Thanks.
Okay. Well, Randy, the service participant, gave a lot of information about his world. He mentioned a lot of things, including family, his relationships with family. Now, while he was doing the world and while he was explaining it, one of the important things in Sandtray therapy is to observe his reactions to certain figurines. Notice how he talks about certain areas of his world. He gave a lot of description about all the different areas of his world, and especially about how he wanted to be closer to his family, but he felt like it was hard because of his symptoms from PTSD.
We just demonstrated a therapeutic session. Sand therapy can also have different purposes. We can modify the goal to suit children that are learning to write. The classroom adaptation will show students building a world in their individual sand trays using miniatures that are provided to them. After building, the students would tell the story of their sand world to a partner. They can then learn to organize and sequence the telling of their own stories and how to listen and respond respectfully as their classmates shared theirs. In order to preserve their stories after they created them orally, the students would learn the craft of writing.
This is kind of an intro to some of the themes that could probably be seen in the sand trays, or ways to interpret the themes, I guess.
The first one, as identified by Homier and Sweeney, is an empty world. So if a sand tray has 2/3 of it is not filled, then that could signify that a person may feel like they want to escape from their own environment. They may feel tossed aside by other people. Another example is if a world is unpeopled. So if a world has no people, it just has trees, houses, and not any women, children, it could mean that a person also wants to escape, or they are symbolically expressing hostility towards other people. Another example is what they call a rigid world. So if someone has maybe miniatures all in one row or 2 rows, it could signify that they are a perfectionist. Now that is a generalization, and I want to say that some of the stuff that I'm saying is very generalized, and not every person, this would not be true for every person. So it's always important for a therapist to understand their service participant and to listen to what they're telling you. But if a person has this kind of a rigid world, then it could mean that they want more control. And let's see. They identify, Homier and Sweeney also identify another one, a disorganized world. That could reflect when someone's world is just chaotic. So it could reflect some of that confusion that they may have about events in their own life. And those are just some of the examples of how to interpret a sand tray. Now, like I said, this is just the very beginning. What we're giving you right now is an overview of what sand tray therapy is, or what it could look like. But being able to use intuition, critical thinking, and perception is all very important as a sand tray therapist.
Sand tray therapist certification consists of 2 levels. Level 1. This is for practitioners and advanced students so they can flexibly complete their certification. After Level 1 training is complete, you will receive a Level 1 skills training certificate. Level 2. After Level 1 is complete, therapists can pursue certification by attending advanced trainings. Both group and individual supervision are a part of Level 1. After Level 1 and Level 2 are complete with required supervision hours, you would be a certified humanistic sand tray therapist. Supervision hours are roughly 90 hours, but varies with different training location. For additional information on training opportunities and certification, please visit sandtraytherapyinstitute.com.